Now it's my pleasure to turn the podium over to my predecessor as Surgeon General, David Satcher, former CDC chief, as well as Surgeon General of the United States, a friend, a mentor, and I know someone known to all of you as an iconic figure in public health, Dr. Satcher.
Thank you very much, Surgeon General Carmona, and let me first express my appreciation to the Stop Obesity Alliance for the outstanding work that you're doing and for the recommendations that you have brought forward at a very critical time in our history. Now, when you're Surgeon General of the United States and you have formerly been director of the CDC and you refer to obesity as an epidemic, it gets a lot of attention, because at the CDC and the World Health Organization, as you know, we had reserved that term for infectious disease outbreaks. But when we looked at the data and saw that between 1980 and 2000, there was a tripling of overweight and obesity among children in this country and a doubling of overweight and obesity among adults, we felt very comfortable in referring to obesity as an epidemic in America. And as you know, we now know that it goes far beyond America. I want to just spend a minute talking about the implication for our children, because I really think that we as a nation have a responsibility to our children that we have not been living up to. One of the programs that we started after leaving government was the Action for Healthy Kids. And basically, that is a program that works with schools throughout this country. We have programs in all 50 states and the District of Columbia. And we have worked with schools to try to see if we can move toward creating environments at school that are conducive to children developing lifetime habits of physical activity and good nutrition. We have acknowledged that in many ways we have helped to habituate our children to habits of sedentary lifestyles, of the consumption of salts, sweets, and fats, and that by the time they become adults, it's very hard for them to lead healthy lifestyles and to be physically active on a regular basis and engage in good nutrition. So in working with the school, we've tried to work with them to create an environment. This effort was significantly enhanced in 2004 when Congress passed the wellness policy, basically saying that any schools that receive funding for free meals and free lunch, especially free breakfast, would have to have in place a wellness policy dealing with physical activity and good nutrition within 2 years. Well, guess what? Within 2 years, 94% of schools had those policies in place. The problem is they have not been implemented in most of these schools. And when you ask why, they say that we can't afford it. When we talk about health system reform, as opposed to just health care reform, we're talking about all of the systems that impact upon health. We're talking about the fact that children who lead healthy lifestyles perform better academically. They do better on standardized exams. They're better disciplined in class. They're less likely to be absent from school. So the investment that we are making in education is enhanced when we invest in healthy lifestyles in communities and in schools. So that's why we talk about health system reform, because it's the recognition that the health system is not just about treating disease. Even though now we spend over 95% of our health budget on treating diseases, many of which we could have prevented in the first place. It is time for us to look at how we can better invest our health dollar so we can prevent disease. Not only is it more cost effective, it's also more humane because it prevents unnecessary pain and suffering. So I think that's what the Stop Obesity Alliance does. It certainly deals with what happens in physicians' offices, and it suggests that we need to incentivize programs where physicians can pay more attention to preventive interventions. But it goes beyond that to say that in our communities we can invest in environments that are conducive to children developing healthy lifestyles, that are safe places for adults and others to be physically active, and that in fact rewards healthy lifestyles the way many of our businesses have done. Clearly we know that workplace wellness has paid off for businesses. And the range of benefit are from anywhere from, for every dollar invested, businesses realize $2 to $4 at least of savings. They realize savings in terms of the cost of health care for their employees, in terms of reduced absenteeism from work, in terms of increased productivity at work. So businesses, by investing in workplace wellness programs, have shown the benefits of that. And in our health system for the nation, we must invest likewise. So I think that's our major message. Over 4 years ago, I became a member of the World Health Organization's Commission on Social Determinants of Health. And after visiting countries throughout the world and looking at different models, in November we came out with our report on the social determinants of health. And the major message, of course, was that the conditions in which people are born, grow, learn, live, and work have major impacts upon their health. And therefore, nations are advised to really invest in improving those conditions, whether it's at school, in the community, in the workplace, in the doctor's office. We need to invest in improving the conditions in which people live and work and grow and function. So I think as we reform our health system, it must be health system reform and not just health care reform. And it must be with the realization that we can, in fact, enhance the health of the American population while treating their diseases. No one can argue that this country probably has the best health system in the world for people when they get sick. If you have a crisis in this country, we can take care of you. The problem is we are overwhelmed by crises. We have to get to the point where we're not seeing all of our emergency rooms jam-packed with people seeking care, many of them who do not have health insurance. The most expensive form of care that you can have is an emergency room where nobody has a record on you and nobody knows your history. So we need to really invest in a system that, in fact, helps to keep people well and coordinates the care, especially the care of chronic diseases like diabetes, like cardiovascular disease, like several forms of cancer, all of which increase in the setting of overweight and obesity. But the Stop Obesity Alliance is not just about stopping obesity. It's about stopping the lifestyles that lead to overweight and obesity. It's about investing in healthy lifestyles. And that's our challenge of today, and that's our opportunity. And you remember what John Gardner said that life is filled with golden opportunities, carefully disguised as irresolvable problems. Thank you.